Welcome back. Breast cancer is the most prevalent cancer among women in South Africa, affecting 1 in 28 women. So the question is, who is high risk? And when do you know when to get a lump checked out? Well, to mark Breast Cancer Awareness Month, we focus on the importance and benefits of self-examination and early detection. So let's discuss this with Jackie Smilg, the Chairperson of the Breast Imaging Society of South Africa. Jackie, thank you for your time. A warm good morning to you. The big question is, who is most at risk of breast cancer? Is it still just women, or both genders actually can equally be at risk?
Hi, good morning, and thank you for the invitation this morning. Today marks the start of October month, which is the Worldwide Breast Awareness Month. Although we try and keep it in focus throughout the whole year, it's a particular month where we hope the world goes pink. And for that, to answer your question, it is absolutely both men and women that are at risk for breast cancer. Breast cancer does not have only one cause. It is a multifactorial disease, and in fact, we probably don't know all the causes at the moment. Certainly, some of the top risk factors are age. With increasing age, there is certainly an increased risk of breast cancer. But having said that, we're actually seeing a lot of young people with breast cancer. You have family history, genetic histories contributing to your risk factor. If you have family members that have had breast cancer, you may be at increased risk for breast cancer. There are lifestyle factors that can contribute to your risk: obesity, excessive alcohol intake, excessive fat intake, if you're overweight, and then also your personal history, if you've got a personal history of breast cancer, or depending on the type of breast tissue. Those are just some of the factors, along with hormonal factors, that can increase risk of breast cancer in both men and women.
So, Jackie, when or how do you know when to get a lump checked out? And I'm glad that you mentioned that, even though it's Breast Cancer Awareness Month, you try and make efforts to ensure that South Africans are aware throughout the year. And I can imagine this year being a tough one with COVID, everyone being focused just on COVID tests. But when do you think is the best time to get a lump checked out?
Okay, any lump actually should be checked out, no matter what your age. There's a misperception that if you're young and you've got a breast lump, it can't be breast cancer. That's not actually true, although most lumps in young people are not going to be breast cancer. But in fact, if you detect a lump, the answer is you should actually get it checked out by a medical professional at your local clinic or at your local doctor, and if necessary, they will send you on for further investigation.
Yeah, and I know that self-examinations are quite important and beneficial, Jackie, but I can imagine for some people who may be intimidated by the process, thinking, geez, I'm not a doctor, I don't know if I'm doing it the right way, I don't know if I'm feeling it the right way. How would you then advise for those self-examinations to be done effectively?
Self-examination is actually a very tricky thing. It sounds very easy to say, feel your breast, and if you feel anything lumpy, or you must get it checked out. Breasts change throughout the month under different hormonal stimulation, so at different times they can feel very lumpy and bumpy. So in fact, breast examination is probably extremely very tricky. What we encourage people to do is to get to know their breasts. If you feel your breasts once a month on a regular basis, more or less for women at the same time of the hormonal cycle, you hopefully get to understand what is normal feel for your breasts. And then if you pick up something abnormal, if you see any indentation of the skin or puckering of the skin, changing color or pigmentation, you would then go to your local clinical breast professional.
And also the different alternatives of treatment that we have. What's out there in terms of patients who do test, or rather who do find out that they have breast cancer?
The breast cancer is a very personal disease. Not everybody's experience with breast cancer is going to be the same. And there should be a multidisciplinary team that looks after a patient who's had the diagnosis of a breast cancer. It will very much depend on the stage of the breast cancer in that specific person as to what the treatment is. There are very many treatment options, including surgery, hormonal manipulation, medical oncology, radiation therapy. But not all people will be offered the same combinations thereof. It will be personalized to your cancer in the individual.
All right, Jackie. Well, thank you so much for bringing awareness to this very much important issue. That's Jackie Smilg.